60 Minutes Overtime.
This week for 60 Minutes, I have a story called The State of Texas, and I'm actually reporting from my home, the state of Texas, and we're in the CBS affiliate here in Austin, Texas, who has helped us out to make this story possible.
We're just going to check your temperature is 97.9.
Our story is about rural health care and the challenges that rural communities face, specifically rural hospitals and rural clinics, as they prepare for the pandemic and whether or not they'll survive after the pandemic. In the last 10 years, 21 rural hospitals have closed. So that's left 1 in 5 rural Texas counties without a doctor.
So this is our little labor and delivery unit.
We went to Calhoun County to the hospital there. It serves about 26,000 people. They have 10 full-time doctors, so they're already down. They were already operating in the red. There's a very large uninsured population there, so they were giving away about $6 million worth of care every year. And what they told us is just the cost of preparing for the pandemic, getting PPE, has really hit their budget.
Like everywhere else in the country, we don't have enough personal protective equipment. We're worried about that. We are reusing what we have and trying to ration it as reasonably as possible.
We spoke with Dr. Leanne Falcon, who is a doctor who works at the Calhoun County Hospital, but she also runs a clinic just down the street.
It's empty.
It's empty.
Yeah, and I never thought I would see that.
Because they're a smaller hospital, they don't need 50,000 masks. They need maybe 5,000 masks or 1,000 masks. And a lot of the suppliers didn't want to sell them that small quantity, and they couldn't afford to buy the larger quantity. While we were there, nurses were actually sourcing, trying to find masks, trying to find gloves and things like that.
Our hospital is financially struggling on a good day.
Yeah, right.
So now this normal equipment, which we'd probably pay, $1 for, 50 cents for, and now we're paying 20 times that. It's just crazy.
Are the prices gone up that much? Yeah, so usually the masks like we're wearing, these, or like Dr. Falcon's wearing, we pay about 6 cents each normally. We're paying up to $1.20 each now, so.
It's pretty dire. We have 1 box of N95 masks left for our entire clinic.
1 box to serve how many people?
We have 8 total physicians and nurse practitioners, and we have a box of 20. And so right now, the best plan of attack for that is just to minimize the number of physicians seeing these patients and utilizing the equipment, so we use as little as possible.
A lot of people right now with COVID are looking more and more towards telehealth as an option. It obviously eliminates that doctor to patient contact and doesn't require PPE. So there's a lot of positives about it. The challenge in Texas is that not all areas of the state have reliable internet.
Is there one thing that if you were screaming at your neighbor and said, "You're not going to believe this, I'm trying to practice medicine here, but this is the thing that is stopping me right now," what is that thing? What is like the dumbest barrier to providing care?
I think high-speed internet and providing me telehealth.
Yeah.
We spoke to Elizabeth Ellis. She's a nurse practitioner in Bedice, Texas.
Yeah, you have a little bit of fever.
She tried to use telehealth. The power wasn't reliable, the internet wasn't reliable, and so often what she was doing is getting in her car, physically driving down these country roads to visit her patients because it's not an option in a lot of parts of the country.
The shortcoming of telehealth is the people on the other end have to have internet access.
Correct.
They have to be able to use
Reliable.
technology.
Reliable.
Is that the case?
I have many patients who don't even have a phone because they can't afford one. Or they get a pay card. Well, they've lost their jobs right now. So their phone's cut off. They can't go buy a minute card. Mm-hmm. I have patients who have no internet, no computer, no smartphone, or they have unreliable internet.
Texas is now 9th when it comes to the number of COVID infections positive test results, which is pretty low for a state the size of Texas. Unfortunately, Texas is also near the bottom of the pile when it comes to testing. So the next couple weeks are going to be real interesting to see how it plays out as the economy opens here in Texas.